One. You know what? This is my first live in person recording for anything. I just thought about
Really?
it as I was sitting down. Yeah.
See, you're
Um,
very natural.
Thank you. I appreciate that. I do things very it's sporadic. It's very like you see how quick I went and I grabbed the ring light. I got
Yes.
these microphones.
I'm
Shout out to
like,
Jordan.
dang.
Jordan had the microphones on deck, so I'm gonna get some of these. But
Yeah.
as you can see, we're here. We're at Sex Down South, and I just stumbled across the Fulton County Department of Health. Is that what it
Yep.
is?
Sexual health educator,
All right. Yeah,
public
it was
health
the shirt. That
educator.
was what it was. It was a shirt, Ask a Sexpert. I was like, oh, yeah, what we got here? And we
Yes,
had the
sir.
setup of different things that y'all are giving away. We got the condoms, the lubricant. And one of the first things that we were talking about was the condoms, right? I didn't let you introduce yourself. Introduce yourself for us, and then we'll get into the
No
conversation.
problem. I am with Fulton County Board of Health, but I am a public health educator, and we go out into the community and talk about preventative measures on how to have safer sex. And one of the things that caught his eye was the Ask a Sexpert shirt.
So the shirt did what it was supposed to do.
Yes, sir.
Yeah.
And with Asking a Sexpert, we like to give and get information from the community on what they're dealing with in their sexual health or barriers to their sexual health. So we just like to have conversations. So thank you for inviting me into this conversation. I appreciate it.
I appreciate that you're saying you like to ask people because a lot of people are always told what to do, wear a condom, get tested, know your partner's status, abstain from sex. These are the like directions that we're given, but there's nobody really being curious about what our circumstances might
Absolutely.
be that create barriers to things like that.
I think it's very important to leave it open ended because you don't want to sound like a know it all. And I mean, you can never know enough about public health or safe sex. So I love to hear other people's experience or where they're coming from, why you even have that question. You know what I mean? So I like to get down to the deep parts of it,
Yeah.
but a lot of it is me learning from the community.
And there's people typically go and get testing done or get their sexual health related information, education from like their doctor, their nurses. And lately over the years, I've gone to more like public health spaces and I find that there's a lot more engagement and comfortable talking about sex in this realm or these kinds of places than there is in the doctor's office.
You mentioned something very important. A lot of people have a stigma of coming to the board of health. They're like, oh, if I come there, they're going to release my information to somebody, or it's a very sterile situation, so they don't feel comfortable enough, maybe talking about something that's taboo. But I appreciate the county for at least opening a space where we can have deeper conversations and make people feel a little bit more comfortable. We don't judge anybody who comes and is curious about testing or treatment. We most times just want to know what it is that you need, like what are your real needs. So some people don't feel comfortable talking to Board of Health members, especially if you have on all of the Fulton County stuff or whatever. But like you said, this shirt caught your eye. We have another shirt like that. It's never too safe to have safer sex, or you're never too hot to have safer sex, and it has an ice cream on it with somebody opening their mouth. You don't know how controversial that T-shirt was, but I can wear that shirt anywhere, and it starts a conversation, and that's what I love most.
Yeah, and then the whole thing about like conversations, I think that that's what we're really missing. We think of education as being told what to do, given some type of direction, but the reality is it's a two-way street, right? So you should be able to talk about your sexual health, you should be able to talk about your sexual pleasure, and I think that people see like the doctor and they think about this status, and they're like, you're going to tell me what to do and I'm just going to listen. You know, but it's a lot more approachable and personable when I just see you in a T-shirt that says "Ask a Sexpert," right? Or if you have something that's eye-catchy for the community, and y'all are out here engaging the community to more so learn and identify opportunities to be able to connect and provide the needs or solutions to the problems that we're having, issues we might be facing, and so forth. So yeah, I'm very much
just being at Sex Down South. I mean, shout out to Sex Down South too, because they, welcoming us. This is what our second year coming here, and we continue to come because of the conversations that we have, of the knowledge that we are receiving from the participants here. So I'm excited to be here.
Yeah, absolutely. So people, what can they expect from going to the Fulton County Department of Health?
Hmm. So we have one of the only free clinics in Fulton County. It's called Neighborhood Union. It is in Vine City near Mercedes-Benz Stadium. And a lot of people don't know much about that Neighborhood Union Center because they most times go to like Tim Park Place or Adamsville location. And those locations require you to pay or have a sliding scale.
Mm-hmm.
So at Neighborhood Union, we have a free clinic where you can come and get tested and treated. And
Tested for what?
with STIs, gonorrhea, syphilis, chlamydia, Hep C, HIV, of course, and you can get treated and linked to care. So if we can't provide the service that you need that day,
Mm-hmm.
we also have a network with community-based organizations that we can connect you to as well. So what you can expect from coming to Fulton County is a warm environment, especially at Neighborhood Union. A lot of people love to go there because the management and the team there is very relatable. And it's been times where we have seen people who we know that come in there and they feel comfortable coming back because we haven't breached any information and it's just a warm environment to come to. And then you can expect Safe Works. So we have a program called Safe Works, and they work hand in hand with the community who use drugs intravenously. So we have a needle exchange or syringe exchange program where you can bring in your dirty or used needles and you can get clean needles. And a lot of people were like, "Are you guys supporting using drugs?" It's just like health. It's your sexual health. If you're going to have sex, we're here to provide preventative measures for you and ways for you to come in and get tested and treated. Same with the drug user program. If they're going to use the drugs, we want to be here for them to have Narcan training. We do Narcan training right on site, and also distribute. I'm not sure how many they give them, but you can get some on site at Neighborhood Union as well, and at most of our clinics.
Yeah.
So SafeWorks is really important because people are using drugs, and we want to have a safe place for them to have those conversations and to come and get their treatment.
Yeah, and I think that with intervention programs such as needle exchanges, I see what you mean. Why people think you're enabling people to use drugs. They need to just stop using drugs. But there's so many complexities to that.
Yes,
There's
sir.
so many barriers. There's all types of psychological, emotional, economical
Yes.
impacts on that. So programs like this exist. Like a lot of times people don't understand that the solution to a problem is often sometimes in the quote problem, if we want to call it that.
Yes, sir.
So if people are able to exchange needles and do their drugs in a way that is, not going to create other problems that have ripple effects, then programs like this are beneficial.
Very necessary.
So, and is that everything that we can expect?
That's pretty much everything that you can expect. We do host trainings like myself, a public health educator. We would come out into the public to speak to you.
Mm-hmm.
So we've done anything from going to health fairs to going to senior living spaces, even college and universities. So if ever you guys need like a public health educator to come out to do more educating, you can definitely hit us up, Fulton County .gov.
Okay.
And you can also come to one of the clinics and request our services as well. But anything y'all need as far as free condoms, lube, please come to the clinics. Please come. It's free. We're not charging you for these things. They're out here for you. So find a clinic near you or get to one that is near you so you can get these free products, and make sure you're sharing the information with other people. We have much more information about DoxyPrep, PrEP, and other preventative services that we have. So please come out to one of the Fulton County clinics and get those links to care.
And a lot of people think too that just because you're in these spaces that you have a problem, but really the issue is like prevention, right? We're doing what we can to minimize the possibility of exposure to something, or we want to have the education in place to where if we are exposed to something, we're able to seek out treatment, educational resources, and get what it is that we need. So I know that the name Department of Health, like we think take care of our health when we have an issue with our health.
Yes, sir.
But we can be more proactive than that. And it sounds like the Fulton County Department of Health offers resources.
You said it all. You said it all. And thank you, Stigma, And
so it's something positive for positive people.
Something positive for positive
yeah,
people.
so the whole thing here is like our program is about stigma minimization. We want to minimize stigma. So the idea is that it's fading away, going away. And that's what
And you
we
talk
working
about
towards.
our merch catching your attention, but your merch caught our attention as well because it's starting with STI.
Yeah.
And a lot of people are still calling these things that you run into STDs, but
Yeah.
we've moved from STD to STI. So your shirt caught our attention as well. Merch is very important.
Yes, it's all about the brand. It's all about the marketing. And then shout out to my designer Jenny for the new logo. We talked about this and making it happen. She was able to bring it to life. We got merch on the website at spfpp.org/merch. If you want to check it out, I'm taking pre-orders. All right, but yeah, I appreciate you taking the time, my man. Appreciate
Thank you,
it.
man.
And
Appreciate it.
yeah.
Thank you, guys.
Woo!